Okay, guys, when is it time to ask for help? Depression is one of the most common disorders in the world, but unfortunately, a lot of people don't get the treatment they need.
You're right about that.
Yeah.
Dr. Catherine Harrison-Restelli with GBMC Healthcare is here to break down some of the facts and resources for you. Welcome. Thank you so much for being with us.
Oh, thank you for having me.
Yeah, very timely.
It is.
It affects too many people.
Yeah.
So what exactly is depression?
Yeah. So sometimes people feel depression is that you're weak, or that you failed, or that you've sinned, or that you just can't handle your life. But it's not. Depression is a serious medical illness. It's very common, but it's also really treatable. And that's the message we really want people to know, that if you reach out for help, that help is available, and it works.
It does, absolutely. But there are, of course, a lot of myths floating around depression, one of them being that you're weak, like you just mentioned. Talk to us a little bit more about some of those myths.
Yeah, the idea that sometimes you just have to pull yourself up by your bootstraps, or that it'll get better by itself. Sometimes that works. You know, mild to moderate depressions can heal themselves, but they may take 6 or 12 months before you feel back to yourself, and that's a long time to suffer. You taking care of your family, going to work.
Yes, definitely.
All of that is impaired.
Definitely. So what are some of the early signs and symptoms that we should be mindful of?
Sure. Loss of energy, loss of concentration, loss of interest in things that you used to enjoy, feeling excessively guilty, feeling so slowed down like you're moving through maple syrup, feeling so restless that you can't even sit still. When your sleep and your energy and your appetite are disturbed, feeling hopeless or helpless, thinking of death, those are big warning signs that it's time to get some help from a professional.
That's interesting. Talk to us a little bit about some of the social and psychological causes of depression.
Sure. Well, circumstances matter, particularly for women when things happen in their life or their environment or their family. That's a really sensitive time. But also poverty, racism, lack of economic opportunity, job loss, those can be big stressors as well.
Yeah, but the good news, treatment is available, right?
Absolutely, and it's pretty effective. So treatment comes in different kinds. You can do psychotherapy, which is a talking therapy, and that can be individual or in groups. Medication can be a tool that can help many people. And sometimes folks are nervous about medicine.
Yeah.
They're worried it might make them a zombie or not really real, but when medicine works well, you get you back, the real you.
Yeah. So what is the biggest difference between depression and just feeling sad?
All of us have felt sad, and that's appropriate. If your house burns down or you're grieving someone that you love and lost, you're going to feel sad and down. But when it lasts for a really long time, it impairs your ability to get out of bed in the morning, that you're not doing well in your function at home or at work, and you're just not functioning like yourself, then it's time to get some help.
Are there simple lifestyle changes that we can make day to day that will either alleviate symptoms or maybe even help prevent those symptoms from appearing?
Absolutely. It's a hallmark for depression treatment that you've got to sleep well. So you've got to get up at the same time every morning. You have to go to bed at night. And you shouldn't be drinking or drugging to try to put yourself to sleep. You need to eat healthy foods, and you need to engage with people. Sometimes when folks are depressed, they tend to retreat. And it's really important to reach out, spend times with friends, families, go to church or to synagogue, spend time with your neighbors. Those social connections are hugely important.
Nice. So tell us about the seminar that's taking place tomorrow.
Time for me.
Yeah, we have a wonderful partnership between GBMC and Shepherd Pratt, and GBMC runs a free 90-minute seminar periodically on really good health topics, and I'm presenting on the 16th from 6:30 to 8 on depression and other mental health problems, when to get help and how to get help.
Yes.
That's fantastic.
So
and if you want to learn more about that, the website is up on your screen right now. Is there anywhere else that we can go for more information if we're just curious about learning more?
Sure. We have things both on the Shepherd Pratt and the GBMC website. There are also great resources for the CDC and the County Department of Health, and crisis numbers on the county and local websites as well.
Yeah, fantastic. Doctor, thank you so much for being with us today, for talking about such an important topic.
Definitely.
And hopefully relieving some of the stigma behind getting help.
Thank you for having us.
So important. Wednesday is Mental Health Awareness Day, World Mental Health Awareness Day. So this is so appropriate.
It is very timely.
Yeah.